So, hi, Dr. Karl.
Hello.
Welcome
Hello.
to Kular Hospital.
Thank you. Thank you.
We are honored to have you here. Thank you very much.
Thank you very much for having me.
So, for our patients, we will discuss a couple of things. Like, we have a significant set of patients who are coming from outside India, like Canada, Europe, Australia, US. Like we discussed, the reason is the same because they have long waiting list there.
Yeah.
As you told me, in your country, there is not much waiting list. It's just 4 to 6 weeks.
Yes.
Yeah. But in Indian system, as you saw, one patient was sitting there, he's ready to be operated tomorrow. You know, here we are very fast, only doing, investigations in one day. And then, because majority of the patients are paying from the pocket. So if the patient is fit, investigations are okay, we can take him up next day.
Yeah.
So honestly speaking, I have tried to show you the system. So what do you want to say to the general public, our patients, that if they are coming from Germany, you must have seen Europe, other countries also. Can we consider India to be at least at par or maybe somewhere close to the healthcare system, what you find there in those developed countries?
What I have seen today in your center is really a very, very good level, very high level, which is even better than what we have in Europe. In the most
is it you are saying
so,
just because you are my friend?
No,
or is it honestly coming from your heart?
It is honestly coming from from what I have seen. What I have seen is really is a very high standard, very high level. The whole infrastructure here is adapted to the needs for patients with obesity, because you got very excellent patient rooms with adapted furniture, with enough space to move around, and actually everything is adapted to the special needs for obese patients. Theaters are spacious and very well equipped, and the preparation is straightforward and is very individually adapted to the patient's needs, and you got a very good follow-up. And also impressive is that you still, even with patients coming from a further distance, you are ringing them up and you are trying your best to keep in touch with them and to
do the follow-up,
do the follow-up and to have the results and to counsel the patients and to talk with them if in any case they would have a problem. So
another thing, I feel blessed, working out here. Although it's a village, we are about 30 minutes from Ludhiana and about less than 1 hour from Chandigarh airport. It's on the National Highway 44 actually. So we are blessed to be sitting here. And we are further blessed that we have our own, system. Like you saw, we have 8 members team for taking care of the bariatric outpatients and doing the follow-ups, keeping the records. But then this is probably, I think, possible because in India, this service industry is a little bit more economical than the developed countries. If you have to have so much of staff there only for follow-ups, it might turn out to be very costly project. What do you say?
Yeah, in Europe, so in these hospitals, normally the responsible persons, they are not interested very much in investing money or staff in the follow-up or even in the preparation of the patient. They are very much interested in the core business, which means they want the patients to be operated, and then they want somebody else to look after them.
So the reason here is it's a private practice. If my patient is happy, then the patient sends 10 more patients. It's a patient chain. As you saw today, the patient is bringing the patient. So we are kind of by default, we have to work like this. Our patient have to be happy, only then we get the new patient. So we have to design the system like that. And that's like one. Then the service industry is relatively more economical in India. That's another reason. Then we have our own nursing college. Maybe that's another blessing. We never have a shortage of staff. and we have different categories of rooms for there are categories if a patient wants personal private nurse 24 hours only to see that single patient, and then 24 hours round the clock doctor is also available. So these things like this is like a luxury, like getting a business class or a first class in the aeroplane, but not for double money,
in Europe,
but little extra money.
In Europe, we don't have these facilities. There is a high turnover of hospital staff, and there's a lack of hospital staff, and we have to hire even for short times of lack of staff. We have to hire external staff, which is not familiar with with this kind of pathology, and it's difficult to communicate with them because they are leaving in a short time, and they are not trained. They are not really trained. It's just a bailout system. So but we are doing a good procedure, but it's.
No, I have seen your hospitals, your surgery, everything is like far excellent.
Surgery is okay. So we do good surgery with little complications also. So there's an equal standard. But what counts very much in treatment of obesity is this kind of lifelong follow-up, and because it's a chronic disease and it's not just eradicated by the operation, so we have really to look after the patients afterwards, and there is it's not very good, I must admit, in my place, and I find it quite perfectly done in your place. So congratulations.
Thank you. A few months back I was in UK, Dr. Chetan Parmar and Dr. Peter Small. We were in conference meeting, actually, the BOMS, British Obesity Metabolic Surgery Society meeting. So they had a separate session on this, the patients who get operated from outside, the medical tourism patients. So we sat with them and discussed if there is a possibility of patients from UK coming to India for an organized kind of medical tourism, wherein the patient will have, one central registration number. Patient gets registered out in the UK, comes here only to selected center of excellence registered by the Obesity Surgery Society of India. And then we have a central data wherein the medical doctor, the family doctor can pull the data. Like I showed you the Zoho data we are having. If I give my access to you, and you have some extra patients from Germany, you send them to us, but then you can see their data. And even we keep calling them, like you saw our system today. In the evening, we call the patients from Canada, from US. In the afternoons, we are calling patients from Australia, depending on the time what they have in their countries. So it's very easy because service industry is much more economical in India. So, but if we join hands together, maybe your governments and Indian government, especially the Punjabi government, because we have a lot of Punjabis sitting outside India. They need treatments, and along with them, they bring other friends. Like from Australia, we see one Punjabi coming with 2 Goras, because they are in the waiting list. They have seen couple of them, they have seen the results, then they right away fly to India and come for treatment. But only thing is, we need to have confidence. We need to see each other more frequently. So I would request you, whenever you come, you have your friend Dr. Atul in Ludhiana, and whenever you come, see him. So please come to see me as well.
Will be a pleasure.
We are blessed and honored by your visit.
Thank you very much again.
Thank you very much. That's it. Thank you.